Hello, welcome. My name's Stephen Scowcroft. I'm the Director of Operations and External Affairs at Lymphoma Action. And we're just waiting for a few more people to join until we start off with our Getting the Best Out of Your Medical Appointments webinar. So we're doing this as a part of a series in conjunction with Leukaemia Care. And we've got a great panel for you today.
So I'm Pam Mackay. I'm a consultant haematologist and I work at the Beats in the West of Scotland Cancer Centre in Glasgow.
Hi, I'm Charlotte. I'm one of the advanced nurse practitioners working in haematology, specialising in lymphoma at the University Hospital of Wales in Cardiff.
Hi, my name is Sandra. I live in Warwickshire. I'm based in Oxford, and as Stephen said, I'm not a medical practitioner, so I have lymphoma, non-Hodgkin's lymphoma, so I have an experience of it, hence being here today.
Hello, I'm Mike. I'm from Inverness, beautiful Inverness today. 1999, I was diagnosed with cutaneous T-cell lymphoma and had 2 stem cell transplants, and I'm in remission.
Thank you. And my colleague who's going to be helping to facilitate today is Nick York from Leukaemia Care. Nick?
Hi, everybody. Thanks for the introduction. Privileged to be with you all, and everybody, thank you for attending. I work with Leukaemia Care in patient advocacy and healthcare liaison. I'm looking forward very much to this discussion.
Just a bit of context around that. Obviously, we know that there's been quite a lot of impact on COVID-19 on people's experience of attending hospital, attending appointments. So that's what we really wanted to focus on today, a bit about how those have changed and how to get the best out of them kind of going forward as well. So we just wanted to start off actually Sandra. So see, things have changed quite a lot since everyone had face-to-face appointments was the most appropriate way of doing that. What have your been experiences at this moment in time, and what has worked well or what could be improved from your point of view?
I think obviously prior to COVID, all my appointments were face-to-face, and I travelled into the hospital and saw, generally speaking, the same consultant. And obviously since COVID, that's all changed. I've always had telephone consultations since then. I was fairly anxious about having them, I think it's fair to say. My experience of them is that they've worked pretty well for me. I think you have to be fairly focused. I think you have to be fairly clear about what you need to learn from that consultation. So writing lists and prioritising that list as well. So knowing what's really important and what perhaps can wait until next time, for me was really key. I think the things that I miss the most is the body language. So understanding when that consultation might be coming to an end, and there's usually a sort of shuffling of papers. You get to understand that, the consultation is about to finish, which you don't get over the phone. So I think also not being afraid to say, actually, I've just got a couple more questions, if that's okay. I think it's not being frightened to speak up if there's something that you feel you still need to get from the consultation. I mean, the plus side has got to be that there's no parking and travel issues. There are some bonuses from not travelling in for the appointments. And also not knowing when the call is going to be, although you get a time for your slots, particularly at the beginning. I think hospitals found it difficult to stick to those times, but I think generally that's improved. But not knowing when that call is coming, and not having that anxiety when you walk into the waiting room. I think lymphoma patients, we all tend to have that anxiety when you walk in and you see everybody waiting for their appointments. You don't have that, so you can be carrying on doing the washing up until your phone call. There's lots of distractions in your own home that you don't get at the hospital. So generally speaking, they've worked well.
Yeah, thanks. And Mike, you've got a different experience where, what's your take on this as well?
Yeah, staying in the Highlands, obviously remoteness is huge up here, and even in normal times, video appointments and telephone appointments are normal, and have been for years. I was treated down in Ibiza, where Pam is, for both my stem cell transplants, and the majority of my appointments with my team, my transplant team, were done by video conference. Yes, I did have my specialist nurse beside me most times, but you had to get used to the concept of fighting your side to get heard, because we know Zoom and video is horrendously difficult to work with. So I call it getting my pointy elbows out and making sure I'm heard. And I agree with Sandra, making up a good, clear list of questions that you intimate that you want answered before the call is finished. That's really important. But video and telephone calls work well. I haven't had many during the pandemic, I have to admit, but I had a checkup with my team in Glasgow. I've had a number of appointments with my GP, and they've all worked really well. I think we need to get our head round it's a different way of working. And I think it's going to become more and more part of our daily life going forward.
Thanks. So I'm going to go to Pam now. So Pam, obviously you've heard this from the kind of patients' experiences and what they've been going through. How has it been for you as a consultant in a hospital?
Well, varied, and I guess that depends where you work. So because I'm in the Beats and we're not part of an acute hospital site, which has a lot of disadvantages, but has the advantages in that we can keep this kind of relatively COVID-free. So we, at the very beginning, we cancelled clinics, made them all phone appointments. But what we were finding was, and again, it's very patient dependent. So some people are very anxious about coming in, and we're more than happy with a phone call. A significant number of patients were not happy with the phone call and wanted to come in. And even if they admitted that they were feeling absolutely fine, they didn't actually have any clinical concerns. At the end of it, they would say, but I would actually really like to be seen and examined. And so we found there was a lot of duplication, that we were having to bring people back into the hospital. And I guess we were kind of asked to keep the numbers of patients attending clinics down to about 30%. And we haven't been doing that because it's just creeped up. But I think we've done it safely. Obviously people with colds and coughs and stuff or fevers don't get in the first place. The clinics are all well spaced out. And we've done our very best to keep it sort of fast flowing. So we are seeing people, and what we've kind of moved to doing is seeing them and then making their appointments a bit longer the next time, with the arrangement that they phone us if they have a problem. Because a lot of the phone calls, I get Sandra and Mike obviously have their list of questions, and some patients do. Many just have a chat, and it's actually not a good use of their time or ours. So I think we've kind of moved to probably see more patients than many others will, in other parts of the country. But I think because we can do it relatively safely because of the setup at the Beatson.
Thanks. And yes, obviously it's going to be slightly different setup in every single hospital case, depending on the tier that they might be in at that time, or the impact of COVID on the hospital at that current time. But Charlotte, from your perspective, I know you've been doing a bit of work, actually doing some research around this as you've been changing and delivering your services in different ways in Cardiff.
Yes, yeah, and I'd say we've definitely had a bit of a different experience because we haven't had that opportunity to be a bit more prepared. We sort of are in the middle, the big hospitals in the middle of like a 10-year plan already to try and get outpatients numbers down, because it was becoming unsustainable. There just wasn't enough clinic space for us. So we had already started a few things, like started a few nurse virtual clinics, but when COVID came along, it definitely was a shock to the system. We had to make sudden changes, and I'd say we definitely have some vintage computers here, so being able to do sort of virtual or video appointments definitely wasn't available at the start, and we've only just really sort of caught up with that. So we went mostly to telephone follow-ups. I'd say I work with quite a few different colleagues, so I think all the doctors wanted to do something slightly different with their own clinic. So we definitely had a bit more of a chaotic approach. You know, one consultant likes to use the telephone appointment as a bit of a triage and see whether you need to book a face-to-face or whether a telephone is okay. And other clinics, we've been giving people the choice of whether they want to come in or don't want to come in. And that's quite a good thing. But all of our clinics, I would say, are taking a lot longer because if we're seeing people, we need that sort of time to clean down the room in between people. And if we're on the telephone, we're often sort of chasing results. And I think we definitely don't keep to our appointment times, which I think is something we have to work on. We have tried to do a little bit of feedback. So we've done an audit. We did a telephone audit and a postal audit for about 100 people, just to see really what this massive change has made. We're usually very conscious of you know, having that patient experience and patient engagement with any changes. So this one, in a way, we had to make the change and then gather in information after. And we've had sort of mixed results. So I'd say we got sort of an 80% satisfaction rate with the telephone follow-ups. But if we also said, you know, would this be okay to carry on? And again, we got mixed results, depending which clinic really. Our low-grade lymphoma clinic, a lot of people like to come in and have the physical examination. So you know, they were more keen to have more face-to-face appointments. And then our complex or our discharge clinic, people like to be seen face-to-face as well. So it's sort of mixed reviews across the board, but I think we were going to have to make some changes, and COVID has just brought that forward. So it has been a very interesting time.
Yeah, thanks for that. And actually, we've got a bit more time a bit later just to focus on kind of getting the best out of your appointments, whatever the mode of it is. I wanted to hand on to Nick now to kind of take us through some of the things about face-to-face appointments as well.
Thank you, Stephen. Thank you, everybody. That's really interesting, listening to how everybody has implemented the change that's been forced on everyone, and you know, explained what was the norm isn't now the norm, and obviously now the majority or a greater majority of people are being seen remotely, or not seen remotely is probably the operative word. One of the questions that this is leading to is that patients are still having to attend in person for appointments. That could be for treatment, or it could be for testing. And the patient group, you know, knowing they're clinically extremely vulnerable to COVID, are obviously quite concerned about increased risks. So I was going to go back to you, Charlotte, if I could, and really ask you, you've been explaining a little bit about changes to service delivery, but what reassurance can you offer to patients that need to attend clinic and need to be there in person? Because obviously there's a lot of concern and fear at this moment in time.
Yeah, so I suppose my advice really is to find out what's in place for wherever you're visiting. I know we've got some sort of green, red and amber areas, and we've also had the opportunity to use some facilities in our local private hospital, which is considered a green area, so completely COVID-free, as in they swab everybody before you're allowed in. So I think the important thing is really to know where you're going, what the setup is. I'd say everywhere really across the NHS has got safety measures in place, and that's, you know, the social distancing, the hand gel, the washing, the masks, the visors. And I think you know, I think across the board NHS clinics are all following the same guidance with that. So I think there is a risk, leaving the house is a risk, but hopefully that risk is relatively low if it is controlled.
Thank you, Charlotte. Pam, would you be able to share your experience from practice in Scotland and as a consultant with your patients?
Yeah, I don't suppose I can share the Scottish practice. I can share, you know, our Beatson practice. I mean, we actually took the view that we had to be really careful that we weren't compromising patients' treatment. So when this COVID came at the beginning, we did cancel things like maintenance rituximab, things that would, you know, not affect overall, or wouldn't make a big difference to the overall survival. But for the more curative tumours, high-grade tumours, we did our very best to make sure all the treatments were done in time. Actually, we haven't had resistance in these patients from coming in. If they're required to come into the ward, a bit like what Charlotte was saying, they get a COVID swab first of all, so they have to be COVID negative, and we only have planned admissions. But obviously for the clinics and day patients, that's not possible. So you just have to kind of make sure you triage them coming in, make sure nobody's got any symptoms. And we have managed to keep it relatively COVID free. And most people, you know, we have cut the number of maybe of visits to the medical clinic, and patients will be seen at pre-assessment by the nurse and only contact us if they've got a problem. So maybe seeing less of the patients than we normally would. But you know, I think it's important if you've got an elderly patient that you started high-grade lymphoma, you started intensive chemo, and they do need to be seen and assessed that you're not, you know, they're tolerating it, they're responding to it. So we have kept going, because what we didn't want to do at the end of the day was compromise their lymphoma care or their CLL care. So I think it's a bit of a balance, and we're not seeing too many patients. You know, if people are very anxious, they'll tell you. If they don't want to come up, they'll tell you. But most people in treatment have been actually happy to come up as and when we've suggested.
Thanks, Pam. Just from another point of view, is that patient preference. Charlotte, you were talking about the study there with regards to feedback that you've been getting from patients, but if a patient has a preference for face-to-face, is it purely a clinical decision in which way a patient should attend, either remotely or in person? You know, can this still be offered to a patient that insists that they want to be seen face-to-face? I mean, the safety measures that you've both gone through there are really reassuring from that point of view, but patients are expressing, you know, their preferences to you in your study. So I'd offer it really to you, Charlotte, in that respect, what your thoughts are.
So, I mean, I think mental health is just as important as physical health. So if you want to attend for your mental health, that should be just as high a priority. And I would say, I don't know anybody that would be refused that. You know, it might not be as quick as somebody wants, or in the same manner as they used to, but I think everybody would be able to be seen face to face. I think everyone is running a service, and you know, we haven't stopped treatments, so you know, you do have to see people face to face, so those clinics are available. And I think if you want to be seen face to face, then you would be.
On that note, there are obviously going to be patients where you're going to make clinical decisions as to when you would want to see them in person and when you wouldn't, and when you would prefer a remote consultation. Pam, could you share a little bit more about how you make the decisions on when somebody should see you in person or remotely?
Well, I guess it depends on their underlying diagnosis, their support at home, and whether they're on treatment or not. So I know what Charlotte was saying earlier, a lot of the low-grade patients not in treatment like to be seen, but I guess these are a group that we have, if they are happy and, you know, examine themselves or are quite comfortable, we haven't brought them up as often. We've more intended to bring the ones that are, you know, on more high-grade and on treatment, basically. But I think, as we were just saying there, you know, we've had patients who, you know, will say, no, I feel absolutely fine, I've not got any concerns, but they've maybe had a family bereavement or something, and they're just generally anxious and have asked to come up for reassurance for examination. And, you know, we've tried our best to accommodate them, because I think, as has been said already, a lot of people are really struggling mental health-wise. You know, you've got a condition underlying that. So we have seen a number of patients, as Charlotte says, they might not be your priority getting it quickly, but we will arrange to see them as soon as we can, and knowing it's reassurance, and we're not picking anything up, it's just purely they feel better having come up and it helps them.
Thanks, Pam. Following on from that, are you able to share any challenges you might be experiencing around, delivering face-to-face appointments, perhaps around communication with PPE and actually undertaking physical health checks, so that patients understand how you're overcoming these?
I mean, from the point of view of the clinics, the PPE, we just wear masks, aprons and gloves for every examination. And, the patients are wearing masks. I don't know, I think one of our what we're trying to do is actually reassure patients so they're not too anxious when they are in the hospital. So I think that's quite important, that the medical and nursing staff appear calm and comfortable with what they're doing. And as I say, there's actually not a huge amount of anxiety about COVID among the patients they're anxious, but it's not stopping them coming to hospital. They're maybe being careful outside, but I think they feel comfortable. I'm not sure, is that what you were meaning, Nick, or were you meaning, did I pick that up wrong?
Yeah, I think that's where I was coming from that point of view, was actually, are you experiencing, what challenges might you experience at this moment in time with face-to-face that you wouldn't have experienced in the past? And one that comes to mind is obviously PPE, because patients aren't necessarily able to engage with you at a personable level, and there's an element of distancing involved in all practices. So I'm just wondering if there were any additional challenges in there. That's one of the questions that have been raised.
When you're sitting at clinic, everybody's well apart in the clinic, but we're still examining the patients. And again, it gets back to, some of the other hematological conditions you can manage by phone, by blood results. Lymphoma, generally, you have to examine. So, we have just been doing that and taking the precautions. I think our biggest challenge in the clinic is actually the mixture, and what I think Sandra was alluding to at the beginning is the phone calls and time. So, we don't have separate phone clinics, so it's mixed in with the patients. And there is a pressure when you've got patients in the clinic that you prioritise them. So the phone calls tend to get left. And with all the best will in the world, our clinics never run in time anyway, I don't think. So, the phone calls are left. Some patients, I think, find that a bit frustrating, but there's a limit to what you can do, because you have to prioritise those that are actually sitting in the clinic so that it doesn't get kind of bunged up.
And I suppose on a face-to-face basis, patients probably find it easier to communicate with you in that setting. I'm mindful, Sandra and Mike, apologies, I've been focusing all the questions at Charlotte and Pam, so I really just wanted to, have you had any recent experiences of face-to-face appointments? I think you were saying that you do, Mike, and looking at how have you actively prepared for these appointments?
Yeah, I haven't had face-to-face appointments at all. Okay. Everything's been by phone over the COVID period. But what I will add is, when I was going through stem cell transplant, I was more behind stem cell transplant before COVID. I was more stressed about going into my local hospital because I was so open to infection. So the world we're living just now, people lived in that world before COVID came along, because of how our immune systems were so knocked back. So probably I would be happier to go into hospital now than I was 2-3 years ago.
Good point. Yeah.
That's very interesting, and that's a good position, to pay, bearing in mind as a moment as well that it's winter time, and that this is a vulnerable period for patients. You feel quite practiced. Sandra, please, have you anything you can add? Have you had recent in-person appointments, or have you your own views?
I haven't had any face-to-face consultations in haematology, but I have been in for blood tests. But what I would add is that as a lymphoma patient, particularly one who's had treatment previously, we tend to be quite aware of what we do when we go to public places. So we're quite good at not touching door handles if we don't have to, and not using public toilets if we don't need to, and wearing gloves, particularly this time of year, whenever possible. So I think we generally, as a group of people, are quite good at avoiding contact as much as possible. But I haven't been worried about going to hospital because I know that there are such precautions in place. The most challenging thing is usually finding the arrows of which way you're supposed to go, because it's all tends to be one way these days. So, but no, I wouldn't have any concerns about going in, because I think as well as the extra precautions we've got at the moment with masks and sanitizers, we've also got the sort of inbuilt knowledge of how we need to protect ourselves as we go.
Thanks, Sandra. Bearing in mind that the topic of the webinar is looking at making best use of consultations and preparing, how do you and how have you prepared for in-person and would you prepare for an in-person consultation and visit today? Have you any perspectives there that you can share how you prepare?
I think much the same as I did before, but obviously not forgetting that you need your mask, your gloves, your sanitizer. I would always think about what I'd take with me, so take the minimum in with me. So whereas I might have taken a book or a magazine or a newspaper, I tend not to do that. I would limit myself just to looking at my phone while I'm waiting. But probably not much more than that. I mean, just to be very aware, distancing, 2 meters, that sort of thing, but probably not much more than that.
Thanks, Sandra. Just before I pass it back to Stephen, any last comments that you want to add, Mike, about preparing for face-to-face?
Yeah, in the COVID time, yeah, you would just be very mindful. I think you would put your big thinking hat on and be more aware of your environment. But again, I'll stress back to my post-stem cell transplant. That's what you had to do anyway. You didn't go to toilets, you didn't touch handles, you didn't go in lifts. You stayed out of the waiting rooms. That's just what we did. So, yeah.
Thank you, everybody. Hand things back to you for the moment, Stephen.
So the other thing we just wanted to cover in this section as well, before moving on to focusing on other kind of generally being prepared, was obviously we've heard that people aren't going into hospital for their routine appointments necessarily as much. Some of that might be telephone, video, but actually we generally, both organisations, are very supportive of the fact that you know yourself when something isn't right and what to do in that kind of situation. Obviously, people are keeping an eye on their condition and how that goes forward, but they're not necessarily being as Pam said as well, they're not necessarily being checked as often, and therefore what should they do in that? I think, Charlotte, we had a couple of points that you wanted to just highlight in this area for people kind of checking themselves every year, which is a natural thing for people to do maybe on a daily basis, but you don't want to also heighten people's anxiety around that. So how would you kind of suggest that people manage that going forward?
Yeah, I mean, I think I'd say times are changing in general anyway, and I think people are getting more empowered rather than just leaving everything for the doctor when you go for the appointment. So I think in general people are much more aware of their body and what the disease does to it. I think it's really important for everyone to find out what their individual symptoms that they need to look out for would be, because they are different even between the lymphomas. There are definitely sort of red flag symptoms, like weight loss or overwhelming fatigue or new lumps or bumps. But again, I wouldn't want people to get obsessed with the examination bit. I think some people like to examine themselves and other people don't. And I just think it's really important to know your body. And I think if anything abnormal happens, you'll know, while you're taking a shower or bath, you'll feel something abnormal. And I think if you do want to feel your lumps and bumps, definitely get a little bit of background from somewhere credible as well. I know Lymphoma Action, a good little video about feeling your lymph nodes. and that was used with the Live Your Life course. I think, you know, get some credible advice and feel your nodes if you want to. But I think it's more important really to know your own body, and then you know when things aren't right.
And in those cases, that's when there normally is at least a telephone number to call, or a person like yourself, a clinical nurse specialist, in order to get in touch with if you're worried at that stage, or go to your GP if you've come out of the kind of the natural pathway.
Yeah, definitely. I think hopefully, again, times are changing, and most people will be getting sort of discharge summaries after treatment, or treatment summaries that should have all those contact details on, and it should really have those red flag symptoms on as well. No, not everybody gets the opportunity to have one of those, but I think hopefully everybody would have some key contact numbers.
Good, thanks. Yes, and both Lymphoma Action and Leukaemia Care have relevant resources around helping with this as well. Okay, we'll move quickly on to kind of getting the best from your appointment. So this is kind of irrespective of whatever the appointment is. Obviously, actually planning in advance, getting the most out of it is really important. And I think I'll go to Sandra to start with that, around whether it's a telephone or a video or a face-to-face, as we touched on. Generally, how have you found getting the most out of those appointments?
I think, as we said earlier, the most important thing is to understand what you feel you need from that appointment, and that will vary as you go through. I'm under treatment at the moment, so this period of time where I've been having the telephone consultations has been quite an intense period for me. So understanding at each appointment what are my burning questions, what do I need to get. So I tend to keep on my phone in my notes section, as I think of things, I will just put them into my notes section on my phone, so I've got a list there. But I think prioritising them, understanding which are the really important ones, as we've said, are quite key. And I think when you're waiting for results, that's always a key area when you go for your appointment. So for me, I always like to ask at the beginning, do you have my results today that we can discuss? So understanding at the beginning that we will be able to discuss them, rather than getting halfway through and realizing that actually they're not back yet. So asking that question for me early on is quite important. And as we said, not being afraid to ask those questions, but also summarizing at the end. In my experience, the consultants are very good at giving you a sort of roundup at the end of what we've discussed. But for me, I quite like to also summarize back to them my understanding of it, to make sure that I've understood it clearly. It's one thing for them to explain, you know, round up what we've talked about, but to make sure that you have the same understanding as them, I think is really important.
No, thanks. Yeah. And Mike, with your pointy elbows, how do you kind of get into that position to be able to get across the things you want to really cover in a particular consultation?
Yeah, I would agree with Sandra. I kept an ongoing notebook. Often the questions came at silly o'clock at night, and you couldn't sleep, so the best thing to do is plant them in a notebook and you can get some sleep. You always went in with an end in mind, meaning you had your top 3 questions that you were going to ask. The main thing I found over this 21 years I've been on my journey with my very reasonably rare type of lymphoma is, because it was a skin lymphoma, it reacted for years and years and years. So I actually kept a photographic diary of how my skin was, because it changed so often. You lost what it should be like or what it shouldn't be like. So that was important. I often had a lot of change in treatments, a lot of radiotherapy, chemotherapy, stem cell transplant. So I needed to understand what each one entailed, what was part of it. And the one thing I found out quite quickly was I really had a great difficulty in radiotherapy lying on a radiotherapy table, because I have spinal osteoporosis, osteoarthritis, so I couldn't lie for a long time on a radiotherapy table and get the full body molds and a face mask. I had a big face mask as well. So we had to plan that all into being able to do the treatment, especially during the hours of setup time. So it's making sure you understand the whole process. And once you understand it, then you can ask more questions about, well, what does that mean? Because of I've got this phobia, things like that.
Thanks. And again, so yes, I've got the links to the resources there. Both Lymphoma Action and Leukaemia Care have some quite good checklists or things to help you to prepare questions to ask your team if you haven't got those yourselves as well. I was going to go to Pam. So Pam, kind of, what from your experience do you feel that what can patients ask you to get the most out of their appointments in order to kind of make your job easier as well?
Again, I think it's very variable depending on the patient. So some patients want a lot of information, want to understand everything that's going on. Others don't. I think it's partly a Glasgow thing, to be honest. Some don't really, just let you get on with it. So, but I think from a patient's point of view, you need to know why you're getting the treatment, what you're looking out for, what to report, just all the things that have been said. I think one of the difficulties at the moment in COVID time that we're finding is the GP availability is hugely, it's very variable. So some GPs seem to be working and, patients can go to see them, others just aren't. And so we find we're getting a lot of questions and things that are actually more GP related that we're struggling to answer. And you feel very sorry for the patients because it's a difficult time, but that's quite a big challenge. But from the point of view of the lymphoma side of things, it's just, asking so that they're happy with the information that they're getting, but it's variable and not everybody wants a lot of information.
Yes, and as you said there, it's very much around the kind of it's almost like shared decision, shared understanding of what the next steps are in a particular treatment pathway. So that's really important that that the patient involved in that knows all of the things that are happening. And that actually kind of brings us on probably to the next side around actually recording your appointment. So Nick, do you want to kind of lead on this and then perhaps the next one as well?
I think looking at it from the angle of attending an appointment, can be stressful and worrying, and it's often important to have the support of a family member or a friend during an appointment. Sometimes to be able to collect the information or remind you what was discussed. So being able to revisit that information is really important for people. So I suppose the first question really is to the healthcare professionals, to Pam and Charlotte, really is, is it okay to bring a notebook to an appointment, for example, or how do you feel if patients ask if they can record their consultations with you, on their phones, if it's in person, or if it's a remote, via Zoom or by telephone. And it's on speaker, for example. How do you feel about your consultations being recorded? Are there any issues there for you?
And I was about to say to that last slide, how to prepare yourself. I would have said bring an extra pair of ears with you and go away with written information. That's really part of being prepared. So I think notebooks, I think, are absolutely brilliant because people just can gather questions over time in between appointments that on the day might not seem important, but it's always nice to go over everything really. So notebooks, I think, are brilliant. I've definitely had voice recorded during a consultation, which can be a little bit off-putting. I'd say, I wouldn't like to say that I say anything different that's recorded that you wouldn't not recorded, but I think it just makes you a little bit more aware and a little bit takes away that bit of that compassion because you're conscious of it. I've never asked to be videoed, but that's because we haven't got the video consultation. But I would say, to me, not using it sounds quite threatening, because it might be used to go home and have a chat about with friends and family, but it's sort of out of my control. I've lost control of that. You don't know whether someone's going to take a bit and edit it and put it on Twitter or something. So I've never come across it, but to me that sounds a little bit uncomfortable. But I'd say bringing somebody with you, or being able to do, I know that Attend Anywhere, you can bring a relative onto the screen to talk. I think that's a really good idea. I don't know what Pam thinks.
Probably similar, Charlotte. I think writing notes is not a problem. Lots of people bring in notebooks and write that, and I think that's absolutely fine. Recording on the phone, I've only, I think, once in all my career, and I'm nearing the end of it, been asked if I could be recorded. And actually it was a really complex situation with multiple biopsies, problems with the diagnosis. And I kind of thought, oh, I really don't want this recorded, but because I felt I was going in circles and wasn't explaining as clearly as I might, kind of hopefully normally. But actually the patient came back and said it was really helpful when they went home and kind of listened to it all and seemed to get something from it, even though I wasn't sure I was making myself clear, never mind to them. But so I think that's very rare. So, and I'm not terribly comfortable with it, because I do think, as you say, you've lost control. I'd rather have somebody in the room and have the discussion then. I mean, I've not had any video recordings. What we have done occasionally, and particularly during COVID, is if family members haven't been allowed in with the patient to the clinic, they've put phone on loudspeaker, or, and somebody, so they've heard, from outside, and that's worked okay, and they've been able to ask questions, and I don't mind that at all. It's the recording I'm slightly uncomfortable with, but I say sometimes it obviously helps on certain occasions.
Thanks, Pam. That's really insightful, because obviously, looking at a webinar now, patients are able to revisit the content and the information, because people don't often pick that all up in a meeting. So with that in mind, I don't know, I was really asking Sandra and Mike, do you have any specific tips on helping, on how you make notes or how you remember what's discussed in your consultations? Because one thing many patients do share is that they can go to an appointment with a list of questions that they have in their minds, or they've prepared on a sheet of paper, and they could be discussed and answered, but they leave the appointment still with these questions and or not remembering the information.
Yeah, I think the second pair of ears is always the best thing. Not that I've had any appointments lately, but I'm not sure how that is happening. But definitely having the phone with the other pair of ears listening in and taking notes, it's important. One of the things I always find useful was, once an appointment was finished, especially if I had to go all the way to Glasgow, 3.5 hours, and come all the way back again, there was loads of time to unpack it as we were driving in the car. So one of the things to do after an appointment is go and have a cup of coffee and discuss the appointment and unpack it when everything's fresh in the mind, rather than leaving it for a few hours and then try to explain it to a family member. Best try and do that immediately. And don't rush away from the appointment, and make sure that you've got the contact numbers of your specialist nurse, because my ones, we call her our mother hen. She was the mother hen to us, and if we were ever confused, she was right at the end of the phone. Text, email, it was no problem.
Thanks, Mike. Sandra, how do you tackle this?
Yeah, I think very much like Mike. I think it's important to get it straight in your head. So we're all different. Sometimes we want to tell family and friends straight away, but other times you want to be able to digest it yourself to really understand what was being said, because often you'll get lots of questions from the family members. So you sort of need to be clear that you've understood it. I think definitely I would write down the results, on paper whilst you're getting them. Write them down there and then, so you don't have to recall them. They're actually on paper. And also, as Mike said, don't be afraid to talk to your CNS if there's something that you can't quite remember, or you're not sure if you've really understood. Ring your CNS. I'm sure they would be happier to talk it through with you and reassure you of what was said, and have confusion further down the line.
Thanks, Sandra. That's a really good segue, actually, because I wanted to ask Pam and Charlotte, really, how can they actively involve in current practice with COVID and in face-to-face? How do they actively involve and encourage participation and attendance of friends and family during a patient's consultation? How do you both go about that? Charlotte?
Yeah, I suppose during COVID it's been a little bit more difficult because you are trying to cut the numbers down in clinic. But I'd say we still actively encourage it for new patients, or if you're talking about any change in plans. I know I've definitely had to phone sort of sons of people who have come with their wife maybe, and you've gone through something really complicated, but because you've cut down those numbers, you've then got to go over it all again, with another member of the family. So I think I'll be looking forward to when we can invite more people in. I think it's really important to have that support and to have somebody else understand what you've got to go through, let alone just someone there to talk through what's been said.
Thanks, Charlotte. Pam, have you got any thoughts in this area of how you actively encourage participation of family and friends, and how you manage to overcome current barriers?
Well, I think, as Charlotte was saying, we're not encouraging as many family members to come in. So at the moment, we ask them to stay outside in the car or elsewhere in the Beatson. And for patients like new patients, yes, we'll get somebody in, not a problem. Patients you're giving results of tests after treatment, or changing treatment or bad diagnosis or something, then we will ask for them to be accompanied. Quite often patients, if they're maybe more vulnerable, elderly, will want a family member, and we do allow them in, but what we usually do is one of the nurses or somebody will go and get them when we're ready to see the patients, so we're keeping the numbers in the waiting room to the minimum. But we're certainly not seeing lots of people who just come along. These patients or relatives are not getting in at the moment.
So it sounds as if this is making work for you in one area, because obviously if companions and family are in different locations, you were having to have separate conversations. I mean, perhaps one of the most basic, you've also pointed out about having a speaker outside of the consultation room where somebody could attend. Maybe something as basic as possible is people having their remote consultations, as the majority are by phone, of just having their phone speakers on and allowing their family member or their partner or friend to actually be able to participate in, through the phone would probably be one of the simpler ideas. But it does sound as if it's a big challenge, and we're touching about appointments now, but it's obviously going to be a challenge for those that are in patients as well. Stephen, I think.
Yeah, I was just going to say we had a couple of people on there, and I think you covered one of them in that, particularly at initial diagnosis, are people able to bring a member of the family then? I think obviously it's going to be, it's really, you have to obviously get in touch with your own hospital in that case where you're having that, but from the sounds of it, where it can be done or where it can be accommodated, then that's what generally people are trying to do. We've had another one that's around is email contact with CNSs. You mentioned kind of texting or email as well. Is that still supported, or is it more sporadic as people's pressure of work being and perhaps working in other areas as well means they're not able to necessarily respond to those emails? Or Charlotte, how is that something that you're dealing with?
I think it's different across the board, so I don't like to talk. I can talk about my experience.
Yes.
In that, we definitely encourage emails and texting, especially. And personally, texting is really easy for me to get back to. And the emails, I'd say during COVID, the emails have just gone wild. So, you know, often I find myself at the end of the week picking up an email that I should have really responded to at the beginning of the week. So I do a lot of apologising to say, sorry, I've only just found this. So I think having a variety of ways to contact is a really good thing. I think the old-fashioned just leave a message on the answer phone is, you know, in the past now. So I'd say I encourage it, but I know other CNSs, sometimes some people don't like emails or don't have the ability to text. Yeah.
And I think, yeah, generally the message is, as you're starting to kind of build that relationship up with your hospital or the CNS, kind of what we said about being prepared, being empowered and having the confidence to say how you would like to communicate and how you'd like to be involved. And it's about having that conversation in order to get the best of how it supports you in conjunction with what the hospital can do based on kind of technology and support and workforce, etc. So I think that's the main message out of today. Thanks for that. So just conscious of time as well, I've got a couple more questions that we've got some time for. So we've talked a lot obviously about the types of appointments around consultations and things like that, and how to get the best out of those that opportunity. But obviously you touched on a couple of things where you might have an appointment that's not really about a consultation, it's about either a routine test or a blood test, and then actually having your treatment as well. So obviously some of those things can't happen over a telephone or over a video, but perhaps you can just touch on that, Pam, to start with. How have, in your experience at the Beeston, have you been able to accommodate tests? Either have those been, you know, if it's blood tests, have they been able to be done in the community? We've had experiences of people having mobile blood labs that have kind of gone around the community as well in order to do that. What has happened where you are?
Again, it's very variable and it seems to change fairly, you know, as COVID's kind of evolved, things have changed. So it kind of depends. So patients that we think we need to see anyway for examination or up for treatment, we will tend to do the bloods in the Beetson. We will have some patients where the GPs are willing to either go out to older, frailer patients who can't come out, or the patients can go to their GPs, some arrangement there. And then we have some hubs that are set up. I have to say, the hubs, I don't personally arrange it, but I know the nurses can find it really difficult and time consuming to get it sorted. So there's no kind of one size fits all. It kind of depends on what's needed. I mean, it's certainly helpful for some patients if to get the results in advance, you do the telephone consultation at the clinic and post out the chemo. That works, but that doesn't work for the majority of the patients we see. So a lot of our bloods are still done in the hospital.
Okay, and yes, well, I think there were a couple of questions around treatment and treatment changes, but I think we've touched on those quite a bit as we've spoken through where experience of where treatment has needed to carry on. It has carried on in a kind of COVID secure environment and making some adjustments that where it's not been as much of an impact to perhaps pause or to stop treatment for a period of time, then that's also been accommodated, and that's part of the kind of recovery and getting back to those treatment where necessary as well. So just got 3 or 4 minutes. I think just one as a kind of last question to go around everybody as well. So obviously we've seen lots of examples today about things that have changed and had to change, and you know, as a result of being forced to change as a result of COVID. But perhaps what would you like to see differently that we can learn from that experience, so that when we come out of recovery and kind of a new normal in terms of the landscape for that we don't just lose that opportunity as well? Perhaps to start with Sandra for that as well. What have you seen that you would like around appointments and around regular checkups, etc., that you would like to see continue that's happened as a result of the change?
I think for me, although I was quite anxious about the idea of doing telephone consultations, I think what I have realised along the way is that moving forward, I would be quite happy to continue with telephone consultation while things are stable.
Yeah.
I think you learn along the way with lymphoma that you imagine that at every appointment that will be the time when they find something wrong with your bloods and you might need treatment. It's all a bit scary. The reality is that you have a much better understanding yourself of what's normal and when things are changing slightly. So having the reassurance that if you needed to be seen and having a face-to-face appointment when you need it, that would be great. But other than that, when things are pretty routine, to be able to continue with the telephone consultations, I think would be really helpful for me. I gather, I understand it's different for everybody. We've all got different circumstances, but yeah, I think there's something to be said for continuing them.
Thanks. And Mike, your thoughts?
I had my 5-year checkup post-transplant, and I got my bloods done at the local surgery, and I had a phone call to review my my post-treatment with the Beatson. It saved me 4 hours journey down to the Beatson and 4 hours back. And you do know your body. Sandra knows, I agree with Sandra, you know what to look out for. And I was convinced I had a kidney infection about 3 weeks ago. So I called the surgery, GP phoned back within a couple of hours, and I had antibiotics by the end of the day. I would have normally waited for a week for an appointment. So it makes you think. Best use of time, best use of resources. It's an interesting way forward.
Yeah, thank you. And actually, as Charlotte, as you mentioned, some of this has been kind of accelerated as a result of COVID, but was actually things that were in plans as part of the kind of long-term plan in the NHS and in individual hospitals and trusts anyway. And so I think generally part of the message is it's about the choice, giving people the choice to have what's right for them. But yeah, what's your kind of thoughts on that kind of going forward?
Well, I'd say there are two really good things that have come out of COVID, and it is about that acceleration of bringing the future forward. And one is moving away from the dependence of the hospital base. I think we all get very obsessed with the specialist centre and people coming in have to come in to see us, where they definitely don't have to come in, and the primary care can do a lot to support, and using a lot of the charities out there as well. It's often much more useful joining up to one of these the charity talks like this one than it is driving to the hospital and having a 2 or 3 minute chat with one of the doctors that you might not have ever seen before. So that's been really good. And my other thing is definitely empowering people more, bringing that element of choice in. Again, we never gave anybody a choice. You had to come in and see us or we wouldn't see you. So, introducing that choice, I think, is absolutely brilliant. And that's definitely something I'd like to carry on with.
No, thanks for that. And that's certainly something that both Leukaemia Care and Lymphoma Action, as part of our roles of kind of helping to facilitate the voice of people that are certainly kind of championing and putting that there in some of the discussions we've had around kind of the recovery and getting those systems in place. But Pam, the reality is also you've got to try to kind of implement those and work with those as well. So what are your kind of last thoughts around what the future might hold?
Well, I think it's changed, and I think certainly for certain, it again depends on what type of lymphoma you have and also the distances travelled. So for sure, there's a group of patients who I think are better served with telephone calls. I don't think we'll be moving. I get what Charlotte says. I mean, we try quite hard to know our patients, so they sort of tend to attend clinics where they would usually know the doctor. So I think we're never going to lose a huge amount of patient attendances, but I definitely think, as everyone said, it's facilitated a change quicker than we might have done. I think we struggle to fit in the calls and the clinical consultations, but there's definitely a group of patients going forward that I think we would certainly continue to do the consultations by call and only see them if there was an issue. Having said that, occasionally you pick something up that the patient didn't think, that's the slight worry sometimes is, we all argue whether we should do routine blood tests and things. Occasionally that picks something up that then drives investigations. So it's not the norm, and you don't want to get people anxious about it, but you don't really want to stop all clinical consultations.
No, that's right, and it's not about kind of having one or the other. It's about that choice, and even for some, as particularly perhaps on skin or where you actually need to kind of see things more face to face, it's about facilitating that as well. Thank you very much to everybody on the call. Hopefully that's answered a lot of those questions. We're sorry if we haven't been able to address all of the ones that you've been put forward. We both have services available to support people affected by lymphoma and leukemia, whether that's through webinars, through our information that's on our websites. You can sign up to receive that information, and we have a number of different activities. And also obviously from the support and whether that's through virtual groups at this moment in time, online forums, as well as our telephone helplines and other support services that you can tap into.
Now, please, everybody that's here in the audience and will be listening to this at a later stage, let's all take advantage of the current connectivity and everybody being used to telephone consultations or being more connected. Charities are here for you and can help, anytime with a call, or use services to help ordering your thoughts before you're attending an appointment, or even if it's to use other services to help with information. And I think one of the things I'd like to do is to thank everybody in the panel for giving their time, everybody in the audience, and everybody's in the back room that we can't see on the screen at the moment that has worked so hard to pull everybody together. And really just to say well done, and everybody stay strong. Things will change soon. And thank you, Stephen, for enabling me to join you today.
So thank you to everybody who's joined us, so to Pam, to Charlotte, Sandra and Mike. Thanks very much for your time this afternoon, and that's been a really useful conversation and really interesting. Thank you very much to everybody, and have a good afternoon and weekend.
Thank you.
Thank you, everybody.
Thank you.
Bye.